be curious, to try and listen to them and see what's actually going on for them. For example, they might be actually quite a bit relieved that, the madness of all the activities has stopped for a while, like all the after school activities. Children can get very, very busy, and so they might be a bit of relief. They might also be quite happy to be spending more time with you as well. So I have spoken with a few parents who were quite surprised about how well their children were adapting to the situation. Children, they're very adaptable, much more than adults. They don't have such an attachment to the way things were before, so they're much more adaptable. Another thing I would advise really is to be quite honest about your own feelings. Like, children learn by seeing, and their first models are really you. So you can model responding to feelings in a way that will be very helpful to them. Like the how to say you can be honest, for example, if you're feeling sad about not knowing when you'll see your family next, or you can you can say that to your children in a age appropriate way, really. You can say that you're sad, you can say that you're angry about the situation, or you can say that you're worried about the disease. It's okay to be honest about your feelings, because it's a great gift in a way to show your children that it's possible to have feelings, even if they're quite negative, even if they're strong, that feelings happen to everyone, to be able to name them and then to share them. It's really something really valuable that you can teach your children. Another bit of advice that might feel like another thing you have to do when you feel under pressure, so many things to do, but something that can be really, really powerful, it's to offer your undivided attention one-to-one to your child as often as possible, like a few times a week, even if it's only maybe 10 minutes, if it's all you have time for. 10 minutes of one-to-one undivided attention, like we leave the phones out of the room, and you let your child be, decide of the activity, decide if you're going to talk, play, or draw, or just, and the idea is to make it quite a special time, to make it their time, that they know that you have this time. This can be, really valuable, especially when time is a bit short, when you're so busy, because there are so many things to manage. One-to-one time with undivided attention will be really quite powerful. I thought about also that it's quite important for children to see what they can do to help. So they feel quite empowered rather than, powerless. So, and children can be quite reassured by rules, like the social distancing. Soon they might be the ones telling you that to keep your distance when you're on the street, or showing them that what they can do to help to stop the virus spreading, or, maybe if they're big enough, they can learn with you to sew their own mask, or, to make drawings at the window, or everything they can, that can make them feel involved will really be helpful. Okay, maybe I will try without the headset. Is that better? Can you still hear me? Okay. And something also quite important that I really want to say is that to remember that help is available. Like, parents are not superheroes. If you're really worried about your child, if there is, if your child don't talk, if you see that your child seems like not to be like their normal selves, help is available. It seems at the moment that everything is closed, but a lot of therapists have kept their practice. They're online. They're offering sessions online, so they can. It's important not to delay looking for help if you feel that your child is not coping really well, or if you feel there is nothing you can do to help. There is professional help around. Okay. Can I add something?
Of course. Okay. I was thinking also about, I've heard many parents talking about small children, like babies and toddlers, and worrying about them, missing on milestones like, socialization and being with other children and babies. And this is a very understandable worry, really, because it was something important before the pandemic, to try and have your child socialize and learn like to be with other children. But on this, I really want to reassure parents that little children are really so adaptable, and they will also really they will cope as well as you do in a way. So prioritizing your own self-care is really, really important, because if you feel well, you'll be, you'll be more relaxed with them, and that will be that will be really, really important. So yes, I think that's a good start. Thank you.
Thank you very much. Thank you very much. Lisa, what would be your advice?
Okay, so Bella, just give me the question again. What's our advice for coping, generally speaking, with our sleep during the COVID crisis?
Yeah, any advice you have for coping with mental health and actually maintaining mental health during this period?
Yeah, I think maintaining our mental health is a matter of really not just looking at our minds, but working with the physical body and managing our expectations about how much we're able to accomplish. I heard in Dr. Coralie's summary, basically, don't try to live up to really high expectations. Just kind of take it easy. I've noticed that we're all in different places with our emotions, with our sleep. Some people are getting more physically active. Some people are feeling much more lethargic. Recognize what's happening for you. And I think, I loved what you said about being honest with your kids. And I think that's predicated upon being honest with ourselves. and that's hard for us to do as adults because of something that we often miss, and even as adults, and that is our capacity to sense. They call the word is interoception. Proprioception is sensing yourself in space, but interoception is sensing yourself inwardly. Am I hungry? Am I thirsty? Am I tired? Am I in need of moving around? And I think the biggest thing that we can do to help our mental health is to check in and think to yourself, what do I actually need right now? And to align that to the patterns of light and dark, nature, and really the demands that we're facing together. And in terms of sleep, which is one of the reasons that you asked me, and I saw loads of questions in the Q&A box about sleep, about having trouble getting to sleep, having trouble staying asleep, having racing thoughts. I'll address some of that in the next little while. And I think, Bella, can I just check with you, thumbs up or thumbs down? I think we're on for about an hour for the whole seminar. That was one of the questions. So one of the things that I think you can do is really acknowledge your need for rest and do it properly. If you're not having a good night's sleep, you're not alone. Don't worry about getting 8 hours of uninterrupted sleep. What I will say is, I'll give you this phrase, and that is, put energy back on the grid. So take a rest during the day. And I'm not saying take a long nap. There are restorative practices, whether it's meditation, whether it's lying down for 10 to 20 minutes, going and lying out in the grass in the garden or in a local park where you feel safe. Line yourself up with the ability to let your nervous system come down so that you're not on hyper alert all day and then expect yourself to shut off like a machine at night, because that's unreasonable, really. And it's damaging to our nervous systems. It's damaging to us psychologically. We need time to digest what's going on within us and around us, to sense it and to respond to it. And as we go through, I'll give maybe some little pointers and tools, but that's my main advice is, learn to be honest with yourself and come back to your own nature. It makes us more adaptive and more resilient.
Thank you very much. Thank you so much.
Welcome.
Zrinka?
Hello. Well, I think I'm going to be echoing a lot of what's already been said, actually. So this idea of recognizing, of allowing, of being curious about our experiences. I mean, this pandemic is something unlike any of us have really ever experienced before. And rather than trying to push it away and trying to make things go back to normal, you know, noticing that we are maybe having a difficult time, that is legitimate. It's a legitimate concern, and whatever your experience is legitimate because it is your own experience. So one of the things that I wanted to do actually was to just actually do a short practice, which won't take more than about 2 minutes. So if everyone could kind of get comfortable in their seats, and just try to sit with intention as much as you possibly can, while also maintaining a posture of comfort, but also one of dignity. So sitting here, back straight, feeling the seat on the chair or on the ground if you're sitting on the ground, and feet planted firmly on the floor beneath you. And just starting to bring yourself here and notice whatever it is that's going on. So notice any thoughts that might be present, any feelings or any emotions that might be coming up for you, or perhaps you feel some body sensations. Just noticing all of this. And if it's 100 different things, allowing 100 different things to be here. Or if you notice that all of a sudden your mind has become empty, that's absolutely fine too. Just allowing yourself to sit and to be present. Now gently guide your attention to your breath. Just noticing wherever it is that you feel it most vividly. So whether that be at the tip of your nose, in your throat, in your chest, or down in your belly. Just feeling the sensations of breath without trying to change it in any way. Not trying to control the breath. But noticing the natural inflow and outflow of breath. And if your mind drifts away from the breath, that's fine. You could congratulate yourself because that's what minds do. So, you noticed. Recognize whatever it was that pulled your attention away and then gently guide it back to the breath. And now expand that awareness to your entire body. Feeling the breath from the crown of your head to the tips of your toes. Expanding on the in-breath. Letting go on the out-breath. Just allowing your mind to follow the natural flow of the breath. Expanding, creating space, and allowing a falling away or a letting go. And when you're ready, just start to come back to the present moment. Gently bringing your awareness to the room that you're sitting in. And when you're ready, blinking your eyes open. So this is a practice that I regularly teach a lot of my clients. One that helps you with just checking in with yourself and noticing whatever it is that's coming up for you. Giving it the space that it needs. And so sometimes doing this exercise will tell you what you need. You know, maybe I need to go for a walk. I'm feeling a little bit, you know, confined here in this space, or I noticed that my breath was moving really quickly. Perhaps this is a sign that I'm feeling a bit anxious. You know, just allowing yourself to notice that, because as I said before, I mean, we have a right to feel whatever it is that we're feeling. So I hope you take that practical advice with you and find that to be useful.
Thank you very much, Zrinka. It was really, really useful, I think, for everybody. So now we're going to move on to some questions from our participants, some that have been sent to me actually in advance before this event. So I think this question would be more for Dr. Coralie. It's from Nicolas, and he's saying that he has two boys, aged 10 and 12, and they don't seem to talk to their friends via Zoom or FaceTime. And they are normally very sporty and social, sport being often the generator of their friendships. So he says that he's worried about his 12-year-old son, as he seems very much down. And he's asking how he can support him or help him overcome this.
Okay. Yeah, I mean, it is difficult. And I don't want to start saying things, you know, about girls and boys, but sometimes it is a bit more difficult for boys, really, because a lot of their social life revolves around sports, and especially team sports, and that's exactly what they can't do. And sometimes they also need a bit more help, like organizing things. So, I mean, it is normal as a parent to want to spare pain and difficult feelings, but maybe the first thing to do would be to try and recognize what's going on. You know, maybe Nicola could say to her son that it's you know, she's noticed that he isn't really his usual self, and you know what's going on. She knows it's a bit difficult because he cannot do the normal, you know, before making a change, like before suggesting something else to do. I think it's quite important to recognize what's going on and to acknowledge that yes, it's difficult, yes, it's not ideal. It would be much better if he could go play with his friends. And hopefully once that's acknowledged, you know, they can maybe think together about something that would be maybe not as good, but that could also provide some kind of social contact, you know, even if it's and this boy might need a bit of help to set it up, or to, you know, like to get it going with his friends. Like it could be something like also based on game, maybe something an online game they could be playing, or, you know, that could be something that Nicola and her son could be researching together. But I just think that it's first important to try and recognize the feeling, really, and parents know their children really well, so they it's already really good that Nicola's noticed this, and that her son is not his usual self. So recognizing and then trying together to find what could help. That's a question actually that parents can help, like how could I help, you know, what could I do?
Okay, thank you very much for this answer. So we have another question from John, which I think will be relevant for Lisa. So he's asking, what are the issues with someone who has had chronic sleep deprivation issues for over 5 years? And he has added that she suffers 1 to 4 hours a night and falls asleep for 20 minutes, micro sleeps only.
Well, what we're touching upon is something that is probably involving a lot of different factors for the person. You know, to do a kind of clinical diagnosis of someone who's had a chronic insomnia for a number of years and is waking up in the middle of the night is really difficult to do in this kind of format. But there are a couple of things that are pretty basic. If we have had a long-term insomnia, A couple of quick wins. One is, the stuff that you would have heard about what's called sleep hygiene. It's really about habits, and it's about, how we're using our food, exercise, caffeine, alcohol, the things that we might go to bolster ourselves up, bolster our energy, or the places where we go when we become distressed. Those are all things that can be sabotaging our sleep. So I'll just say, look for the sleep saboteurs, and maybe instead of doing the things that we know aren't as helpful, look at the needs that you're trying to meet by, say, drinking caffeine, or look at the needs that you're trying to meet by having a nightcap with some alcohol at night, or look at the needs that you're trying to meet by staying up watching Netflix, and meet those in a way that's a little bit more direct for you. Okay, so that's one thing, looking at the sleep saboteurs and putting in some sleep saviors. If she's had insomnia for 5 years, that's probably already been green tick, right? That's already probably been dealt with. The main thing around insomnia is that it's not necessarily clinical insomnia unless it's significantly impairing your function. Some people will actually say, oh, I have insomnia because they're not sleeping 8 hours or because they're not sleeping 7 hours, and they're putting a lot of pressure on their sleep. And the thing to look at is how you feel during the day. Right, that's really important. So what I do when I teach sleep recovery, and in the book Sleep Recovery, I have some exercises that you can use to put energy back on the grid. So for example, here, you've got 3 therapists with you, Bella. Here's a therapist trick that you can use, and the gals with me may already do something like this. If you're feeling exhausted and tired during the day, lie down on the floor, put your shins, right, the calves up, the back of your calves on a chair, lie down on your back and rest for 5 minutes, maybe 10 minutes. Legs up the chair. Sometimes in yoga, they do legs up the wall pose. It's something that involves your body, but it also resets your nervous system, right? So doing that gentle inversion is a fantastic way to help you feel more resilient and give you a chance to rest. I actually did it before I came onto this call because I had a long day with lots of other calls. So that's something that's very helpful to people who have a long-term insomnia, because the fear piles up. We feel like, oh my God, if I don't sleep, I'm going to snap at my kids. I'm not going to be able to perform in that meeting. I'm not going to be able to meet that deadline. And it becomes a lot worse. Okay. So that's one thing. Now, not having the ability to kind of see what's going on with this particular person, there are so many things that I can share. So I'll go to the next piece of it now, which is the waking up in the middle of the night. Okay, so I'm going to draw a little mini diagram with my hands like this. Okay, so there are lots of little U shapes, right? There's a chart called the hypnogram, which shows the cycles of sleep, right? So over the course of a night, we have several 60 to 90-minute periods of going through stage 1, 2, 3, 4, which is non-REM sleep, the deep body sleep, right? Where you're really heavy. And if you look at your partner or you look at your kid or whomever asleep, their eyes are not moving beneath their eyelids. That's non-REM sleep, okay? And then there's another part of the sleep cycle, right? That's called REM sleep, where the eyes are moving. Often in the beginning part of the night, the body is in heavy, deep body sleep. We'll just call it that for the sake of argument, or make it easier. And after the first round or two, the first sleep cycle or two, we've had really deep body sleep, and then our sleep tends to feel lighter. We're in more of a REM sleep. And if the nervous system is a little bit more activated, which it will be if we're nervous about catching COVID-19, if we're nervous about our job, if we're nervous about homeschooling our kids, if we're nervous because we're alone and feel isolated, then the nervous system's going to come up. And at the time when your brain is having more activity, you're more susceptible to wake-ups, right? So I don't know why that person is waking up every 20 minutes, but that's the most common thing, is that there's a hyperarousal in the nervous system. Now, the other thing that's really important for us to know is that respiratory function, like the lungs, how we're breathing, if the lungs aren't working properly and there's something called a sleep apnea, which is a constriction here, it's as though your body is waking you up because it can't breathe properly. That might be in play. There might be some metabolic factors. There might be a perimenopause or a menopause thing going on. So I don't really know without having more details, but these are all places that we look, and then we start to repair our sleep by putting the good things in, looking at the physical stuff, and not just the mind over matter stuff. So all the stuff around acceptance that I'm hearing from my colleagues is fantastic. I completely agree. But there's also a really important part about being able to move things through. So one is to sit with things, right? Accept. And another is to be able to regulate, to be able to lower the charge in the nervous system, to be able to physically pull the tension out of your body so that your body physically feels calmer. There's one little more point that I want to make is that you have a nerve that runs from the base of your skull down through your neck, in through your internal organs, all the way into the pelvic floor. And as I understand it, it's got 10 lanes of traffic, right? And 8 of those lanes are your body telling your brain how to interpret your internal and external world. So the way that your physical body feels will have a lot to do with how you feel in here, right? Only 20% of the nerve messaging is called efferent messaging from the brain to the body. The other 80%, 8 lanes of traffic on that 10-lane highway are going from your body to your brain. So in order to lower the arousal in the nervous system and sleep through the night, it's very helpful to calm the body. We can use the breath and we can use stretching and yoga stuff. Okay, so I'm going to leave it there. I'm sure we can come back to it, but I want to leave some more space. Thanks for the questions.
Thank you so much for your answer. And then we have another question from Sylvia, which I think would be relevant for Zrinka. She's saying that I would like to get some advice on how to feel motivated to tackle household chores that need to be done, but somehow I keep avoiding. I'm focusing on keeping the family healthy, homeschooling my son, and also trying to keep fit. However, I lack motivation and enthusiasm to do these important household chores. Can you please help me with an advice?
Well, firstly, thank you, Sylvia, for your question. I think this is probably something that a lot of people have been struggling with. This sense of kind of, it's like the new age of multitasking. And, especially for us who are homeschooling our children as well, this is, it's creating another layer of burden because, we want our children to get the best education possible. And so sometimes that takes hours out of our day. So firstly, recognizing that, you are getting this increase in your multitasking. It's fatiguing. Recognizing that as well. You're probably feeling a little bit overwhelmed, which is why this lack of motivation is present. So how do you get motivated? Firstly, I think it's really important for you to actually, out of all of this, take some time for yourself. Like give yourself at least 5 minutes in the morning before other people wake up or after you put the children to bed to ask yourself, okay, how am I doing in all of this? And ask yourself also, okay, what have I done well today? Because I think, as soon as we start getting really down with ourselves for the things that we didn't accomplish and really focus on that, we end up actually diverting our attention to all of the things that we actually did pretty well that day. That then contributes to a lowering in our moods, which then contributes to a lowering in our energy, which contributes to a lowering in our motivation. So that is one of the first things to do. Recognize what you're doing well. And the fact that, you are listing, your child's education amongst these things that are important to you, keeping your family healthy, keeping yourself fit. I think these are all really important priorities that seem to be trumping the housework. Now, I also recognize the importance of housework and keeping your environment tidy. Sometimes there is a reflection, I think, between our internal states and our external states. And so when we notice that our area is tidy, is clean, we actually feel better internally as well. So sometimes seeing this as an opportunity, actually. So housework can actually be something that you might do in order to keep fit and healthy. So, vacuuming a room can actually, expel a lot of energy, and on top of it, I think that clearing out of your area will, also, reap rewards with your internal system as well. So, but I'd like to say, as a parent myself, I empathize with you. It is a very difficult situation to be in, but, it sounds like you're doing wonderfully and just keep at it. So thank you.
Thank you so much. Thank you so much for your answer. So we have one interesting question from an anonymous participant, and I think that probably Dr. Coralie can answer this one. How best can the ADD non-attentive type parent sufferer deal with lockdown restrictions, work, and having teenagers at home?
Thanks for the question, Bella. I mean, this is really difficult. I mean, it's I think I'm just going to be touching up on what we've been saying already about expectations on that one person can place on oneself. Really, it is really difficult. I mean, and it would be really difficult without having an existing condition. So so that's what I would say, really, like to not put pressure too much on oneself about perfection, and also to try as much as possible to get the right support. I mean, I don't know if this person has a therapist or, you know, someone that I think this would really be not the moment to stop having that, really. So I mean, and having teenagers at home is can be difficult, and maybe because as a parent, of course, you also get the worries from your children, and you do want to help them, but this, I mean, it's yes, I would say, sorry, to not put too much pressure on oneself, really. That would be my main advice, really, and to seek help when possible, and also to trust you know, your children, your teenager, for, you know, they will go there, they will do their it's, you know, parents sometimes feel like they have to manage their children, and they have to, you know, be the motor for them to do their work, etc. But maybe it's important as well to trust children also, that they will be able to do their work and meet their friends, you know, like that's the good things with teenagers, really, is that they're more independent than young children. Yeah.
Okay, perfect. Thank you so much. And the next question is from Margit, and I think that probably it would be most relevant for Zrinka. She works in the NHS since March, and her friends are avoiding her since then. She asks how to cope with people's paranoia about her working in the hospital and people thinking she may be spreading COVID-19.
Well, firstly, I'd like to say thank you, Margie, for everything that you're doing. You know, I think, you know, you probably have one of the most difficult jobs. I mean, working within the NHS and seeing this firsthand. Unfortunately, I think people are very reactive when it comes to fear. And it sounds as though your friends in your community have, in a way, made you feel a little bit isolated through this entire experience. I think first and foremost, my advice would be to, you know, try to open up a dialogue with them. Let them know how it is that you're feeling. Communicate your concerns to them, and let them know that, you know, you could use a little bit of support, while also recognizing the limitations of what they can offer. So, you know, whether that means, you know, having more opportunity to go online and, you know, have, you know, whether they be conversations over Zoom or FaceTime or WhatsApp, or, you know, finding other ways in order to, you know, have some kind of diversions with your social group. But, you know, I think, you know, recognizing the fact that, you know, you are probably going through a really hard time is extremely important, and asking your friends for that support that friends are often willing and able to provide is extremely important. I'm trying to think if there's anything else, but oh, and another thing also is maybe to talk to your colleagues and see if any of them have had similar experiences. This sense of common experience can actually lift your own, because it may feel a little bit less lonely if you feel as though other people are experiencing the same kind of isolation from their community. But I wish you luck, and thank you for the question.
Thank you very much, Zrinka. So moving on to the next questions, Lindsay has asked, what advice would you give to teenagers whose sleep patterns have dramatically altered? For example, to a teenager who is staying up until 4, 5, or 6 a.m., then going to bed and sleeping in until 1 p.m. I don't know if this question would be more relevant to Lisa or to Dr. Coralie, but whoever wants to take it, it's theirs.
I'm happy to answer that from my perspective, and then hear what Dr. Coralie has to say as well, if that's right. Well, look, I mean, what we know about sleep patterns over the course of our lifespan is that they change, right? So teenagers are not just trying to be difficult by naturally going to sleep later and often waking up later. That has to do with the way melatonin works in the teenage brain on average, right? Just like on average, as we get into our 60s and 70s and beyond, we have a tendency to have less melatonin in the brain, and we tend to go to sleep earlier and wake up earlier. So that's something that's a bit kind of hardwired into the teenage brain. But what's also interesting about that is what is keeping the teenager actively engaged late into the night, because that's quite extreme, actually, 5, 6 in the morning and then 1 o'clock in the afternoon. It would have me be a little bit concerned about mismatching the sleep patterns to the circadian rhythms and the effects that would have on homeschooling or on social activities. So, I would say probably for the teenager, it's really important to get enough exercise and to get that earlier in the day and to try to do something that's fun. I think this is a panel of psychotherapists, so I'm going to hold down the fort for the physical aspect of our well-being. It's not just yoga, it's not just breathing, it's actually going outside, getting realigned to the light and dark patterns that we've evolved to align with over the course of our humanity. And really trying to get early morning sunlight. So maybe, I don't know, have something that's an incentive to wake up a little bit earlier and to do something fun out of doors and to get enough exercise so that you start pulling the sleep drive a little bit further forwards. It's difficult. It's difficult to try and get someone to sleep when they're not ready to sleep. But, I don't want to demonize devices, right? Because there are ways of staying connected to one another right now. But if you can maybe find some really good books for your teenager to read, things that are really interesting, if you can find some other activities that aren't online, getting away from not only the blue light, this is really important, this is for adults and children as well as adolescents. It's not just the blue light coming into the eyes and telling the brain that it's daylight. It's actually the fact that you're in the beta waves, the brain wave pattern that's associated with being awake. So showing your child, your adolescent, your teenager, your young adult, even yourself, that we don't switch from on to off, but we start amping down. We start turning the lights down. We start eating a little bit earlier so that the body can digest properly. That's going to set your teenager up to realign to the circadian rhythms, but know that they're going to perhaps skew a little bit later, and just try and help them build the sleep drive into the earlier part of the day. So I hope that helps.
Okay, thank you very much. I think we're going to move on to the next question because I'm just conscious of the time. We have only 15 minutes. So the next question, I think it's quite important, and I think it would be great for Dr. Coralie, is that Alex is asking, we are preparing to go back to school in the UK. What advice would you give in helping staff and children with their anxieties about the situation and encouraging positive mental health?
Yes, I mean, that's an important question that will be on the mind of many parents. And sorry, I didn't hear really well. Is that about staff as well?
Yes. So what advice would you give in helping staff and children with their anxieties about the situation? Yes. Okay.
Well, it's a bit difficult to answer because, I'm not a medical doctor, so I don't know exactly about the risk in terms of the epidemic, really. But it seems like things are going to be taken quite tentatively, and it's not going to be all at the same time, and things are going to be reviewed as well. So it's not like, things are going to resume as they were before. So I think it's going to be staggered. It's going to be smaller groups in the classroom. So I think it's quite important to keep the discussion open about it, you know, in families, about how different people are feeling, because sometimes it might be like more the parents who are feeling worried, or I can give you an example of a patient of mine who was quite worried, and the parents were wondering, what is she worried about? Is it going back to school? And it was actually the fact that the masks that the parent had ordered hadn't arrived, and she was saying, oh, but what if everyone has a mask and I don't? And, you know, will I be let into school? Or, you know, it's quite important to see exactly what is the worry. And if it's something like this, you know, like then the parents can address it, because buying a mask is something that is doable, really. So really, so I would say just like to keep the discussion open, and for people to and just like it's okay to be anxious, because it's a new situation for everyone, and it's difficult, and it is a scary virus. So but it's really in everyone's interest as well to restart normal life, you know. So and it's, I mean, the school holidays are coming quite soon, so, you know, it won't be for very long as well. It's just to touch base really before the holidays, and then go back hopefully more normally in September. Yeah.
Thank you very much. Thank you very much for this answer. So Victoria has asked us, what should I focus on? I had just joined the gym, started a new job, house renovations, and stopped my antidepressants. Then I lost my job and everything else has stopped. Now my confidence has decreased and my anxiety has increased. I now sit at home just overthinking everything and feeling drained. I don't like feeling this way. What should I do? Maybe this is a question for Zrinka.
Yeah, I mean, that's a very good question. And I think it's one that, I mean, it sounds as though you're feeling quite overwhelmed with everything. But this predicament that a lot of people have been facing with, I mean, the loss of a job, whether they be furloughed and their salaries are decreased or completely have lost a job, you know, it's extremely overwhelming, and it really shakes that that kind of primary foundation when we look at our hierarchies of needs. So when we look at that, I mean, it's about recreating that base, that foundation. How do I establish a sense of safety? How do I establish a sense of security? You know, how can I, you know, what can I put forward? And it sounds as though your question, you know, has to do with what do you focus on first, you know? And I would say that, you know, this is a very difficult time to be finding a job, but I think you need to, if you are not worried about paying rent, if you aren't worried about paying mortgage, it is about kind of recognizing that safety, because I think that's an extremely important one. I know that the government has also put in efforts where, you know, there are no evictions to take place during this time, reassuring yourself with that knowledge that, you know, that you cannot be evicted during this time creates at least that sense of stability. Now, of course, we have to ask ourselves questions as to, okay, how do I put then food on the table? How do I take care of these other basic needs that also cost money? And, you know, this is, I think, where this sense of community that I think that we've been seeing actually, you know, kind of move up from the grassroots has been really striking. And I think it really speaks to how people do come together during this time. And I do hope that you can also fall back on community. So whether it be family, whether it be friends, having that opportunity to share your difficulties with people is extremely important, just so you don't feel alone in all of this. And I hope that answers your question.
Thank you very much, Zrinka. There is a question from Carl for Lisa. Any hints on how to get past the 4 a.m. wake up regime that my brain seems to want to adhere to, even though I do not?
So Carl, the question that you have is about kind of a broken sleep, you know, waking up in the middle of the night, which is something that, you know, I've experienced, many people have experienced. It depends on where we are in the life cycle. Sometimes, you know, towards the latter end of life, it's very normal to experience wake ups because there's less melatonin in the brain. But I would think right about now, a couple of things are really important. One is that if we decrease the level of arousal in the nervous system, if we start taking the caffeine levels way down, that can be one thing. Because what I talked about non-REM sleep and REM sleep, I talked about the deep, heavy body sleep and then the brain sleep. What will often happen is when we've had that deep, heavy sleep, the body's like, okay, we've had a little bit of sleep, and then there's a little bit more of a likelihood of waking up. And that's often when people have that wake up time. It can also, depending on the time of the night, have to do something with kidney or liver function. So you want to be aware that if you're having other things going on with your health, that you consult with your doctor, right? If there are other things going on, get that sort of thing checked. But for a lot of people waking up in the middle of the night, it's like the really heavy hunger for sleep wears off, and then there's a sense of arousal in the nervous system. So two really important things. One is, as I said, decreasing levels of caffeine, knowing that the half-life of caffeine, this is important for you guys if you have waking up in the middle of the night and having trouble getting to sleep. It takes no less than 4 hours for half of the caffeine in your system to get metabolized. So the half-life is 4, sometimes even 6 hours, right? If you metabolize quickly, it's 4 hours. So if you had a double espresso at 4 p.m., right? Oh, it's a little bit slumpy right now, I'm going to have a double espresso. At 8 p.m., you've still got one full espresso kicking around in your system. At midnight, you've got half an espresso kicking around. And at 4 a.m., you still have got the equivalent of a quarter of an espresso. I won't even look at an espresso after noon, so it may or may not be the thing. Alcohol as well, as soon as it gets metabolized, it raises the core body temperature. That makes us wake up, right? If you're having a nightcap, a couple of beers before bed, that can be a culprit. Also, the brain, it increases its levels of GABA, which is an excitatory impulse inhibitor. It means it makes us less kind of anxious. It makes us less lively. We get a nice little buzz. So when that wears off, the brain goes, oh, we don't need to make so much of that. And then those excitatory impulses, which show up as anxiety, as the heart beating a little bit faster, as a little bit of a racing in the pulse, combined with the fact that alcohol becomes sugar and becomes like a little mini sugar rush in the middle of the night, that could be a culprit. I'm not saying that's the case for you, Carl, but for a lot of people listening, that may be something that's a factor. And if it's not a problem under normal circumstances, if there's a level of heightened nervous system due to COVID, due to lockdown, due to the circumstances out of our control, something that wasn't a problem before can be a problem now. The other piece of it is that get exercise early in the day. And then, what I found, and this is in about 20 years of working with people, the sequence of stretches that I've put together with the breath practices, they help you to get to sleep, but they also kind of help you manage to get back to sleep more easily if you wake up in the middle of the night, because you again have that level of tension decreasing. And think about those 8 lanes of traffic. The other piece of it for men is as we get older, as men get older, needing to pee in the middle of the night can be a big culprit. For women, menopause, things like that. So it depends on where you are in the life cycle, but getting a few things kind of under your belt can be really helpful. Habits and practices.
Thank you very much. Thank you. Spencer has asked us a question about kids and online gaming. So he says kids just want to play games online, but it's not healthy. What is too much, but tricky when they want their mates who are on there? But also we've noticed massive behavioral changes to each other and us and their friends. So probably this is a question for Dr. Coralie.
Yes, I mean, it's always difficult to manage with teenagers or even children, like online time and screen time. And at the moment, it's even worse because, as I was suggesting earlier, it's a way that they socialize at the moment because they cannot see their friends face to face. So it's particularly difficult. I mean, from what I heard, you could talk to your children about, what you've noticed and their behavior changing, after they've played and see what they say, see what they make of it. Really, that's what I was talking about before, about the curiosity because children often have a lot of insights about what's going on. So after, in terms of how much, you know, it's really individual to each family. But it is true that I mean, Lisa's talked about it, you know, like in terms then of sleep and you know, and there are many things to be fitting in a day, really, like with the online schooling, the remote schoolwork and the exercise. It's not good if the gaming takes too much space, really. So I think, yeah, boundaries are needed, but as much as possible, I think it's quite good to try to involve the children about, you know, how much do they think is, you know, how much do they think is too much, or what do they think? And then you can have a conversation together about it, and that might make it easier, you know, to set a number of hours. But it's a difficult topic, really. It's and not only during COVID, like use of screens. Okay.
Yes, thank you very much. Hopefully we can squeeze maybe one or two more questions. So Anonymous has asked, as I'm in self-isolation, do you have any tips on how I can unwind? As I live in an apartment, which I can't leave, so I don't have the ability to leave, change my environment. Probably this question would be relevant for Zrinka.
So how to unwind when you're self-isolating? I mean, I think, I mean, it depends on what your interests are, you know. Do you like to read? Do you like to listen to music? This can be a time where, you know, where there's an opportunity actually to connect with some of the activities that you maybe rarely have time to do otherwise, you know, when things are, you know, things before COVID, so to speak. So it might be one of those things to just be worthwhile of, you know, asking yourself what it is that you enjoy doing. I think jigsaw puzzles are a great activity. I've seen a lot of friends doing them and really connecting with them. It's also a great mindfulness activity as well, because you really have to be focused on the different puzzle pieces and putting together. You know, other things is, you know, finding a online video of, you know, to do some kind of exercise. You know, if you're unable to get outside and do that exercise, it is really important, as Lisa has been speaking as well, to get that. And if you can get it early on in the day, wonderful. But I think if you're able to work it in at any time, that's even more important, you know, just to fit it in there somewhere. And yeah, just ask yourself, be curious, and do what you like. So I hope that helps.
Thank you very much. I think that unfortunately our time is up, so our conversation is coming to an end. But I think that we need to organize probably future sessions like that, because I see a lot of interesting questions that we didn't have the opportunity to answer. For me personally, it has been a very interesting and insightful conversation, and I hope that our viewers have enjoyed it as well. I want to sincerely thank one more time to our special guests, Dr. Coralie, Lisa, and Zrinka for taking part and also giving us some practical advice to all of us. Thank you to our viewers for joining the conversation. We will be sending you a follow-up email tomorrow with the contact details of our special guests as well as mine. And if you have any comments or feedback, please don't hesitate to contact me. For me, it has been a great honor to be your host today. Have a great evening and hope to see you also. Goodbye.
Thanks very much.
Thank you.